So that means if you use the wipe on different surfaces, you've got a risk of transferring the microorganism on those different surfaces. What was intriguing is those one in bold, the more transfer you're doing, the more microorganism they transfer. And we were very puzzled with that result. And when we've done some electron microscopy of the wipes, what we can see, this one is a wipe that does not transfer microorganism, the spores, and you can see the spores tightly packed to the fibers of the wipe. On those wipes transfer equally high number of spores, and you can see that the control wipes without the spores. And you can see those big spore aggregates, those plaques of spores within the wipes, and they're very loosely bound in those cases. So it's not surprising that if you reuse the wipes on other surfaces, that those wipes might transfer or will shed quite a large number of spores. So really, a couple of slides to conclude, and I'm running out of time now, but I'll be another 2 minutes. Surface disinfection, do they work? High concentration, long contact time? Yes, they would work. But very often what you have is a low concentration to work with, a very short contact time. And what doesn't help is very often some companies will do some inappropriate efficacy test to show you how they work, but in fact is not the right test they're doing, and they're trying to sell their product on the basis of the wrong test. So bearing in mind we've got low concentration, short contact time, you've got a failure of biocides, where you've got microbial survival on persistent on surfaces, highly likely. That means you need to have additional control measures, hence the use of antibiotics on other measures. Alternative to liquid biocides? Yes, you've got other interventions. I mentioned the wipes. You've got fumigation or deep clean as well, which I haven't mentioned. But again, if you've got high concentration, long contact time, then your disinfectant will work. Can we improve surface disinfection? Absolutely. Can we improve efficacy? Yes, but we need to have a clear understanding of the product limitation, clear understanding of the factors affecting activity, need to have clear manufacturer's instructions, including the limitation of the end product, need to have products which are easy to use. We avoid dilutions. You need to have a product ready to use. You need to have, for the person especially purchasing those products, an idea of efficacy test protocol, because then they can ask those manufacturers the right questions. And especially having a test performed that match the application of the product, and this is not always the case. Alternative, they definitely offer an additional control, absolutely. I do believe in wipes and the use of wipes, but they need to be tested appropriately. And at the moment, you've got so many manufacturers, and I'm afraid to say some of them don't really know what they're talking about, and they produce a product which is not meeting the need or the efficacy they should be. And with that, I'll thank you, and I need to thank some guys in the lab that have done a lot of work and some sponsors as well. Thank you very much.